Good afternoon. On behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. Following today's broadcast, we'll be copying the prepared statements into the text body of our Facebook Live and YouTube live streams. Also, for those joining us online, if you have any questions or concerns, we encourage you to write those in the comment section of the live stream, and we will do our best to answer your questions online as quickly as we can. During Monday's news brief, we had a question from Carol on Facebook, who asked if Wyoming Behavioral Institute, which is the location of our largest local outbreak, is still accepting patients. We reached out to WBI, and they sent us the following statement that we will now read for you. Wyoming Behavioral Institute is meeting daily with local public health officials to formulate a plan for creating spaces within WBI for admitting new patients. Safe discharges are in process in order to create the space needed for the plan to be enacted. We encourage all hospitals, community mental health centers, Department of Family Services caseworkers, and other referring entities to continue to check with WBI's intake team for updates if working with individuals in need of inpatient psychiatric care. Discharging patients are receiving specific instructions for monitoring of symptoms of illness and quarantine. We appreciate community mental health center efforts to coordinate with us to promote quick and efficient discharge through the development of aftercare plans. Following Monday's news brief, Seth with the Casper Star Tribune also asked us a question in regard to the WBI outbreak. Seth asked if WBI is providing testing to all patients and staff, or if testing is being done on a case-by-case basis. We again reached out to WBI, and they provided us with the following statement. WBI continues to do everything possible to address and manage the novel coronavirus situation. We are actively partnering with Natrona County Public Health to test individuals who are hospitalized and exhibit symptoms of COVID-19. Staff can request testing by going to Wyoming Medical Center or Public Health. We have followed the health department's treatment and notification requirements. We have reduced hospital capacity to ensure everyone's well-being, creating isolation areas while still being able to meet the needs of those in crisis. Thank you.
Good afternoon. My name is Tanya Sutherland, Public Relations Officer for the Natrona County School District. Based on the extended state health orders of Governor Gordon, all NCSD schools and buildings will be closed until at least April 30th. Over the past few weeks, we, as a district, have been committed to creating a remote learning plan that serves all students and provides a reasonable balance for students, teachers, school staff, and families. Earlier this morning, I was meeting with Superintendent Hopkins and Superintendent-elect Mr. Mike Jennings, and throughout the conversation, one word continually came to the forefront: grace. Grace to the students whose entire school year changed significantly without warning over the course of a weekend. Students who are navigating an entirely new way of learning while missing their friends, teachers, and everyday normal life. Grace to our teachers, administrators, and staff members who have been asked to shift what had been purposefully developed as a brick-and-mortar operation for many decades into a remote learning environment in a week. Grace to our parents and guardians who are taking on the significant challenge of bringing this new educational journey into your home while also navigating your own employment concerns, economic stress, family life, and more. Grace to the staff, the Board of Trustees, and our entire community, as we are all working together to do our very best to design and implement a new way of teaching, learning, and everyday life in Natrona County. We know and understand you may be feeling overwhelmed and uncertain. If you need additional resources or more information, please reach out to your child's principal or teachers. We ask for your patience, support, and grace as together we navigate this difficult time for all. And for now, some new operational updates at NCSD. Today, April 8th, NCSD Information Technology will be completing a test of our email notification system at 4 p.m. We recognize the importance of reliable communication and are working to ensure all parents and guardians are receiving important information. If you do not receive the test, please visit our website or NCSD Facebook to fill out a contact form for us to contact you individually to resolve this issue. Due to the holiday, this Friday, April 10th, NCSD Food Service will be handing out Friday's breakfast and lunch takeaway meals with the Thursday meal distribution. NCSD Food Service sites will be closed on Friday, April 10th. NCSD Food Service will continue to provide a takeaway breakfast and lunch meal Monday through Friday from 11:30 a.m. to 1 p.m. to all individuals 18 years and under. Individuals may pick up meals for their siblings and family members in order to help assist in maintaining social distancing. Individuals 18 years and younger can pick up meals at the following locations: Oregon Trail Elementary, Sagewood Elementary, Pineview Elementary, Poison Spider School, Roosevelt High School, Bar None Elementary, Mountain View Baptist Church, Cottonwood Elementary, Evansville Elementary, Journey Elementary, Boys and Girls Club Main Branch, Paradise Valley Elementary, the Casper Recreation Center, Midwest School, Verta James Elementary. Signage will be outside to direct individuals of where to pick up the meals. The Wyoming Read celebration, originally scheduled for May 12th for all NCSD first grade students and their teachers, has been canceled for this academic year. We are working together with Mr. John Jorgensen and the Wyoming Reads Committee to identify a date next year to reschedule this year's Wyoming Reads Day at NCSD. Due to the evolving situation around coronavirus and the interest of student, staff, and community safety, we will be postponing the Academic Awards Banquet scheduled for April 26th. The Academic Awards Banquet Committee and the Natrona County School District are deeply committed to honoring student academic achievement. We have made a tentative plan to reschedule the awards banquet for July 12th. Students and significant educators being honored at this ceremony have been sent a direct email with more information and details regarding the next steps. At this time, in the interest of ensuring the health and safety of students, schools, and communities, the Wyoming High School Athletics and Activities Association has canceled all spring sports. We are continuing to work on identifying what's next for graduation ceremonies at NCSD. We understand the incredible significance of these ceremonies to our students and families. A decision on these ceremonies will be made with the first priority being student and community safety. However, we want to ensure that any decision made is well informed and with the most up-to-date information from our county health department. We will provide information as soon as possible in order for students and families to plan accordingly. The safety of our students, staff, and school families remains our top priority. We appreciate the patience and support of our community as we all work together to keep our community safe.
Good afternoon. I'm Haley Bloom with the Casper-Natrona County Health Department. Thank you for joining us today and for your assistance in providing and disseminating up-to-date factual information surrounding coronavirus, otherwise known as COVID-19. As of this morning across our state, there have been 4,064 tests performed, 221 confirmed positive cases, and 62 of those statewide positives have now recovered. As of this morning, 6 Natrona County residents have also recovered. This morning, the Casper-Natrona County Health Department received confirmation of an additional case. This brings the total to 27 positive COVID-19 cases in Natrona County. Here's what we know about the most recent cases. Case number 26 is a juvenile who is incarcerated at the Natrona County Regional Juvenile Detention Center. Case number 27 is a female in her 60s whose exposure is believed to be related to direct contact with a known positive. In regards to the individual at the Natrona County Regional Juvenile Detention Center, as part of policy, all new intakes are placed in quarantine upon arrival. In accordance with this juvenile has been in isolation since arriving at the facility and will continue to remain in isolation to avoid further transmission to others. The juvenile is being monitored under the supervision of medical staff and is receiving appropriate medical care. At this time, we believe there is no risk to other juveniles in the facility and staff are taking appropriate precautions. In Monday's press briefing, we provided some information on 3 epidemiologically connected clusters. We understand there has been some confusion surrounding this information and wanted to clarify it. Cluster number 3, related to Wyoming Behavioral Institute, has identified 12 positive cases. This is a mixture of staff and patients. In total, there have been 532 tests performed in Natrona County between the 2 main testing facilities of Wyoming Medical Center and the Casper-Natrona County Health Department. Of that, 431 were confirmed negative, 27 have been confirmed as positive, and we are still pending results of 74 tests. You may have noticed in the last 3 days that the volume of new positive cases in the community and within the state has declined significantly since the last week. We believe this change is possibly related to the change in sample criteria by the Wyoming Department of Health Public Health Laboratory. In the last week, the Public Health Lab made the decision to restrict the samples they can process to those of very specific criteria in order to preserve supplies needed for confirmation for samples. We want to remind the public that this decrease in new positives isn't a sign that the disease is backing down or slowing down. We believe that in the next week or 2, we will see those new positive numbers climb back up. The majority of tests are now being processed by private labs, which can take anywhere from 3 to 10 or more days to return results to the Wyoming Department of Health, who then reports those results back to us at a local level. We must continue to practice social distancing and other precautionary measures to avoid the spread of illness despite the decline in new positives. Various models are still predicting the state's peak of illness to be a few weeks away. In epidemiology, we explain the cases like an iceberg. The confirmed and diagnosed positives are at the top of the iceberg that we can see emerging from the water. However, the portion we can't see under the water's surface is much larger. Undiagnosed, unreported, or people who are infectious but not transmitting the virus are this larger group under the surface. We expect to continue to see the tip of the iceberg, those who are confirmed positive, to continue to increase in the coming weeks. Please help us to continue to do our part to reduce transmission by social distancing and diligent hygiene. The Casper-Natrona County Health Department hotline and the Wyoming Medical Center Respiratory Clinic are still the recommended resources of those experiencing symptoms. The hotline number is 577-9892 and is operating Monday through Friday from 8 a.m. to 5 p.m. Please call ahead prior to arriving at any healthcare facility so that appropriate precautions can be taken. We do not want citizens self-reporting to the emergency room. If you're experiencing significant shortness of breath, please call 911. Due to an increase in call volume, if you need help with information, events, or things unrelated to symptoms, you can contact us at covid@cnchd.org. We are responding to emails as quickly as we can. Lastly, we would like to thank you for your ongoing efforts to fight this virus in our community. We know many of you are making substantial financial and other sacrifices. The sacrifices you are making by staying home and social distancing are making a difference. Thank you.
Good afternoon. My name is Steve Friel, and I serve as mayor for the city of Casper. This morning, we all learned that the National Intercollegiate Rodeo Association has made the decision to cancel the College National Finals Rodeo. I want to stress to everyone that this was not an easy decision. Leadership on all levels in many organizations have been struggling for weeks, talking through every option, every concern, every person, business, and community that this will impact. While canceling CNFR was a hard thing to do, we believe it was the right thing. We as a group knew that we could not, in good faith, continue planning and preparing for an event to be canceled at the last minute and have an even more severe impact on our community. We know that many of us will feel the effects of this just as many of us are feeling the effect of every other difficult decision that has been made as a response to COVID-19. This community is resilient. We believe better days are ahead of us. Until then, we'll continue to work together through this crisis with our heads held high. Leaders across this community are stepping up and coming together to do what needs to be done to keep us as healthy and safe as possible. Last night, Casper City Council authorized funds to be used for our COVID-19 response. The Natrona County Emergency Operations Center, the group that is running the COVID-19 response for our community, is made up of organizations from across Natrona County that are working tirelessly to ensure we are doing everything we can to be prepared. That does include stand up and operating community medical shelters to relieve pressure from our hospitals. To run the EOC and community medical shelters, additional staff and resources are needed. The City of Casper is taking responsibility and working to ensure that these crucial operations can continue to happen. We have authorized the immediate release of $50,000 to be sent to the Emergency Operations Center. We have also authorized $25,000 for the Casper and Natrona County Health Department to help pay additional staff that will be needed for the future usage of community medical shelters such as the Westwood facility or Casper Event Center. Our neighbors with the Natrona County Commission have done the same. The City of Casper is committed to doing all we can and to exceeding your expectations to be as prepared as possible. We want to thank everyone who is doing all they can, staying home, practicing social distancing, and making difficult personnel decisions to get through this. We appreciate every single one of you. Thank you. We now can have some time to answer questions.
Thank you, Mayor. Our first question is from Oil City News. They are just looking for some more information about our community medical shelters, the event center, Westwood facility, and if patients are already at these sites.
So these two sites have been set up, my understanding now, and we could probably get someone from the Operations Center to answer better, but my understanding right now, we do have some patients that have been moved to the Westwood facility.
Perfect. Thank you, Mayor. That's all. Our next question is from Max Cotton with Wyoming News Now for Wyoming Medical Center. Max is curious about details Wyoming Medical Center released last night on social media that you have cloth face masks missing. They're just looking for a little bit more information on that.
So right now we are doing everything we can to locate the missing mask and determine what happened, but we don't have any more information right now.
Thank you, Christy. Okay, so thank you for joining us for today's Natrona County Emergency Operations Center COVID-19 Response News Brief. You can re-watch this full broadcast at any time on the City of Casper YouTube channel or Casper Natrona County Health Department Facebook page. Our next news brief is scheduled for Friday, April 10th at 3 p.m. Until then, please keep yourselves and your families healthy and safe. Thank you.